All right, so we are going to go ahead and continue on here. This should be the video for Principles of Health Science as well as Sports Med 2. Should be the 30th. So we'll go ahead and continue on. Again, if I had already gone over this material, sorry, let me get to the right spot. You can go ahead and fast forward, but we will continue on here. So let's see. I believe we stopped right about there. So again, a bit of review. When we're checking a responsive person, we need to check sample for our interview if they're responsive. So we look for signs and symptoms, allergies, medications, pertinent medical history, last food or drink, and the events leading up to the incident. Once we have done that, we can go ahead and do our head-to-toe check. So we go head down and then arms last, checking each body part separately. So checking an injured or ill person who appears to be unresponsive now. What should you do if you think that a person is unresponsive? And again, I believe we've kind of went over this. So if a person appears to be unresponsive, we want to shout using that person's name if you know it. If there's no response, we want to tap the person's shoulder if it's an adult or a child, or the bottom of the foot on an infant, and shout again while checking for normal breathing. We want to check responsiveness and breathing about 5 to 10 seconds, no more than 10 seconds. And again, gasping is not going to be considered normal breathing. So if the person is respondent, if they respond either by moving, moaning, or opening the eyes, but yet they're not fully awake, fully with it, we want to send someone to call 911 or the designated emergency number and send someone else to obtain the AED and first aid kit. We'll proceed with gathering information from bystanders, again using that sample acronym. We'll conduct a head-to-toe check and roll the person onto his or her side into a recovery position if they do not appear to have any injuries. Again, we put them in this recovery position if they are not fully awake, but they are responding, again, so they don't choke on their own vomit. So this is what that recovery position looks like. Again, just putting them on their side. So if they have to vomit, they can do so without obstructing their airway. So if that person does not respond, we want to send someone, again, to call 911, get the AED and first aid kit. We want to ensure that that person is on a flat, firm surface. And we need to begin CPR, starting with compressions if they are unresponsive, or we want to use the AED if one is immediately available, again, if we know how to use one. And they're pretty easy to use. But again, starting CPR right away, and as soon as that AED arrives, we want to put that on them. All right, so putting it all together, assessment scenario, checking a responsive person. So I want you guys to kind of think about this scenario. We hear a thud and the sound of something clattering to the ground. We stop what we're doing and we go to investigate. So in this scenario here, we want to kind of think of what we're doing. So we hear a thud, we come across this person. Again, we're going to go ahead because he is responsive and use our sample scenario or sample acronym to kind of gather some information. We'll then do a head-to-toe check on the person. Again, because they're responsive, we need to obtain consent and let them know that we're going to check them and go ahead and go from head to toe with that check. So with a child scenario of a responsive person, we hear someone shouting, "There's something wrong with my child." We stop what we're doing and we go to help. Again, in this scenario, because it's a child that has a guardian there, we can obtain consent from that guardian. We want to then interview kind of the guardian or parent there with that sample format of questions, and then we would go ahead and go through a head-to-toe check as well. So with an infant scenario, we hear someone shouting, "There's something wrong with my child." We stop what we're doing and go to help. Again, similar to a child with an infant, we see that the infant is responsive. We'll use that sample interview style of questions, then conduct a head-to-toe check. Again, obtaining consent from that parent or guardian. All right, moving on to lesson 2 here. So, cardiac emergencies and giving CPR. So, a heart attack, what is a heart attack? A heart attack occurs when blood flow to part of the heart muscle is blocked, causing cells to die and leading to permanent damage of the heart muscle. Okay, so a heart attack is a blood flow issue. Seeking advanced medical care as soon as signs and symptoms of a heart attack are recognized is going to minimize the damage to the heart and may just save a person's life.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
So, again, thinking about it, what are the signs and symptoms of a heart attack? I want you to go ahead and kind of think over what those might be. So, signs and symptoms, and again, it's important to note that not everyone is going to have all of these symptoms, and even if they've had multiple heart attacks, symptoms may not be the same every time. So, some common ones are going to be chest pain, discomfort, pressure squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing position, or taking medication, or that goes away and then comes back. They may have discomfort or pain that spreads to one or both arms, the back, shoulder, neck, jaw, or upper part of the stomach. May have dizziness or lightheadedness, trouble breathing, shortness of breath, breathing that's faster than normal, nausea, vomiting, pale or ashen or gray skin, sweating, feeling of anxiety or impending doom, extreme fatigue, or potentially unresponsiveness. So again, people may experience these signs and symptoms of a heart attack differently. Not everyone is going to have every sign and symptom, and people who have had a heart attack before may not experience the same signs and symptoms with their second heart attack. So some gender differences here. It's important to note that men often have the classic signs and symptoms of a heart attack, such as chest pain that's radiating down one arm. Women often experience milder chest pain or more general signs and symptoms, such as shortness of breath, nausea, vomiting, extreme fatigue, and dizziness or lightheadedness. So if you think a person might be having a heart attack, again, we want to call 911. We want to be prepared to give CPR and use the AED if the person becomes unresponsive and if you're trained in these skills. And we want to help the person to rest in a comfortable position and loosen any tight clothing. We also want to offer to get any prescribed medication the person may take for chest pain and assist the person with taking it if necessary, and reassure the person and monitor his or her condition until EMS personnel arrive and take over. So, cardiac arrest and the cardiac chain of survival. So, differences between a heart attack and cardiac arrest. Cardiac arrest is going to occur when the heart actually stops beating or it is beating too ineffectively to circulate blood to the brain or other vital organs. Cardiac arrest frequently happens suddenly without any signs or symptoms, so it may just come on quickly. So, a couple different reasons that a person could have cardiac arrest. They may have cardiovascular disease, maybe due to an electric shock or a drug overdose, maybe due to severe trauma, may also be due to breathing emergencies. So in children and infants, the most common causes of cardiac arrest are going to be breathing emergencies, chest trauma, and congenital heart disease. Although a heart attack can lead to cardiac arrest, the two conditions are different. Again, remember that a heart attack is going to be a blood flow issue, and a cardiac arrest is a rhythm issue, so electrical rhythm issue. If a person in cardiac arrest is not responsive, so a person in cardiac arrest is not going to be responsive, they're not going to be breathing, and they will not have a heartbeat.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. There is a cardiac chain of survival for adults and one for children and infants. Let's look at the adult cardiac chain of survival first. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as trauma, drowning, choking, or electrocution, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, the fourth and fifth links are early advanced life support and integrated post-cardiac arrest care. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for an adult, child, or infant in cardiac arrest.
So again, primary difference there in the cardiac chain of survival is going to be with children. That first step is going to be prevention, so trying to prevent scenarios in which they may go into cardiac arrest. All right, so moving on to actually giving CPR.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions.
1 and
Keeping
2
your
and
arms
3
straight,
and 4
push
and
down
5
at
and 6
least
and
2
7 and
inches,
8
then
and
let the
9
chest
and 10
return
and
to
11
its
and
normal
12
position.
and 13 and
Continue
14,
to push
15,
hard
16,
and fast,
17,
giving
18,
compressions
19,
at a
20,
rate of
21,
between
22,
100 and 120
25,
compressions
26,
per minute.
27, 28, 29, 30. 1
For a
and 2
child,
and 3
push
and
down
4
about
and
2
5
inches.
and 6 and
And
7
for a
and 8
smaller
and
child,
9 and
you
10
may
and
only
11
need to
and
perform
12
chest
13,
compressions
14,
with
15,
one hand.
16, 17, 18, 19.
Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past-neutral position. For a child, you'll only need to tilt the head to a slightly past-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4 and
Continue
5
giving
and
sets
6
of
and
30
7
chest
and 8
compressions
and 9
and
10
2
and
rescue
11 and
breaths
12
until
13, 14, 15,
you
16,
notice an
17,
obvious sign of
18,
life.
19, 20, 21, 22, 23, 24,
An
25,
AED is
26,
ready to
27,
use, and
28,
no other
29,
trained
30.
responders are available. You have performed 5 sets of CPR, and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You
and
have
7
performed
and 8
5
and
sets of
9
CPR on a
and 10
child.
and 12
You are
and 13,
alone and need to call
14,
911.
17, 18, 19, 20, 21, 22, 23, 24,
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Have
and
the
3
AED
and
and
4
first
and
aid kit.
5.
All right, so CPR with an adult or child. Again, primary differences. With an adult, need to go at least 2 inches. With a child, about 2 inches. The compression to breath ratio is going to be the same in either case. The only other difference is with a smaller child, you may be able to use just one hand versus 2. So moving on to giving CPR to an infant.
If an infant is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground.
The baby's unresponsive.
Next,
Call 911
stand or
with
kneel
the
to the
AED
side of
and
the
the first aid
infant
kit.
and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use, and no other trained responders are available. You have performed 5 sets of CPR, and another trained responder is available to switch. You have performed 5 sets of CPR, you are alone, and need to call 911. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
Have the AED and the first aid kit.
22, 23.
All right, so again, if you're going to be in person, if you are in person, we will practice this. If you're online only, again, once we are completely through all of the course material, there will be a written test that'll be posted that you will need to complete. Other than that, we are done for the day. Thank you, guys.